When I am working with a client and we are trying to work through shame they may associate with their genitals, with their sexuality. It doesn't matter if they are male, female, anywhere on that gender spectrum. We go into thinking about, okay, no descriptives, no adjectives. We just take that view, and I treat from a yoga perspective, which is non-judgmental acceptance. From my work with, other mental health therapists, I know that it's similar to what an ACT view may be, like the acceptance and commitment therapy, where they accept as is without adding on adjectives, right? When I'm teaching, even having people just visually inspect their vulva, whether just let's go with someone with vulva anatomy, just look at their vulva and first just looking at the image and verbalizing maybe something like, I am okay, or even coming back to their breath and staying in that relaxed exhale state. Because when someone is coming with that sexual shame programming, if they are with their therapist, like I am a pelvic health therapist, I'm licensed within my practice scope, I'm allowed to touch. Oftentimes, if someone has that sexual shame programming, they will start getting embarrassed, flushing of the face, their heartbeat will quicken, their breathing will get a little short, right? All signs of discomfort. I want to bring them back into comfort. And we do that with breath, right? Teaching them, you're okay, and we exhale. And I will do it with them till we get that response of going from sympathetic, which is the sympathetic response, to the parasympathetic response, meaning going from higher blood pressure, faster heart rate, racing breath, to calmness. And then again, when you are in a place of calm, you don't judge, right? Because again, in your work of the mental health piece, trying to analyze where these ideas come from, for certain that when someone carries that guilt and shame, it is from the stories that they have brought with them. When someone has told them something, made them feel a certain way, and those are often states where they didn't feel safe in their body, meaning their body was in that fight, flight, freeze response. It was some kind of adaptation, which is why they are carrying that response to something that should be just regular. Like, oh, this is my hand. I don't feel anxious about it. This is my vulva. I don't feel anxious about it. That's how we should be when we are in a healthy place with our intimacy and our sexuality. We are kind of trying to reprogram that shame messaging someone's carrying, looking at their vulva and just focusing on breath and staying in that, this is my center. I am staying here. That is not easy. I know some people will think, oh, that's, especially they're living through this is easier said than done. I love giving them tactile tools. I have like a little fidget loop. From an energetic perspective, when that energy starts rising within that, I want to run away from this. This is something I want to avoid. We give them a discharge. We are allowing them to work out that feelings of shame or anxiety a little bit through that manipulation of the fidget with their hands. While again focusing on breath, that therapeutic presence, right? In my world, in occupational therapy, we call it therapeutic use of self. Co-regulating with the person helps them stay centered. After visual regard, we go to physical touch, and this is completely non-sexual. I even on purpose use anatomical language to make it as quote unquote not sexy as possible. I make this clear distinction that this is a therapy exercise. This is not intimacy. This is not sexual interaction. Even when someone has a partner who is understanding, loving, giving, and wants to be present and supportive, I tell them this is something you will practice outside of those intimate interactions. I tell them you're going to schedule these blocks in. This is your therapy exercise. This is your pelvic floor therapy. You are just going to use pressure at the vulva, so many repetitions on the left side and progressing along. Then we go into instructing that. When people feel shame with their vulva, it's not like anyone showed them a diagram, this is bad. The shame is coming because the things associated with the vulva, the womanhood or intercourse or whatever, that is bad. We are separating the two. We are separating the vulva for what it is and keeping intimacy and sexuality different. Till we can bridge them. The goal is to bridge them and bring them together, but we separate them, helping that person stay calm, stay centered, stay non-judgmental. Because like most of us, right, when we work through something, the strongest critic in the room is ourselves. Teaching people to change their own language is so important. That is where we start. We go from there and we go at a pace someone is comfortable with themselves, we have good success. It works, right? Staying in safety and respecting people and their stories, and allowing them to also guide us in the process to their goals. Right.